Olá,
Olá, pessoal. Boa sexta-feira para todos.
Happy Friday. Estamos dando início ao nosso terceiro episódio de Nursing Conversations. Eu sou a Jéssica.
E eu sou a Cláudia.
E só tô dando essa introdução agora em português para alguém que chegar aí de paraquedas e não souber o que a gente está falando, mas basicamente o Nursing Conversations a gente começou no final do ano passado. É um espaço onde a gente conversa de forma informal sobre nossas experiências, nossas histórias na enfermagem aqui nos Estados Unidos. Já estamos indo aí para 5 anos aqui como enfermeiras, então a gente tem bastante história para contar. E para basicamente trazer público uma coisa que a gente já faz muito no nosso dia a dia mesmo, que é conversar sobre a nossa profissão, que acaba que a gente tem em comum como irmãs. Então a gente pensou, por que não trazer isso para nossa comunidade e trazer um espaço para vocês treinarem o listening também, enfim. Aos poucos a gente vai tendo também mais a opinião de vocês, com tópicos que vocês também queiram que a gente aborde. Isso, estamos com trabalhando no nosso cenário novo aqui. E é isso. So let's get started now in English. It's going to be 100% English, just like we do when we talk about our day and our nursing things. So earlier this week, we talked about the nursing shortage and bedside care and pretty much nurses leaving bedside care, right? So we're going to pick up where we left off on this topic. We're not going to just talk about the same thing over again, but we are going to brush up on some things and get Claudia's perspective, because earlier this week I was able to talk about it in the stories, but she wasn't. So she's going to give us her perspective on leaving bedside care, nursing shortage, and whatnot. So as many of you guys saw and kept up with us this week, we talked about the nursing shortage and how I feel like a lot of Brazilian nurses and a lot of people on Instagram talk about nursing shortage, but they say, oh, it's because the population's getting older. Or, oh, because nurses are retiring, or whatever. Like, all those things, as true as they may be, it cannot be, and it is not the main reason. So we brought that, and like I said, it's not our opinion on it. It's basically just facts, what's going on, what we see going on in the country. Back when you were in the bedside care setting, what was your take on like the high turnover, nurses leaving, needing agency nurses? What do you remember from that?
Well, I didn't work in a big hospital scenario or ER or ICU. So my experience with bedside has been nursing care facilities, so acute care, long-term care. And I had not talked to other nurses because that was our first job when we both got here. So I hadn't been in other scenarios, but now that I have, every time I talk to a nurse and said, oh, my first job was a long-term care facility, everybody's face is the same. Like, oh, that's hard, that's tough. So it's not a secret that it's probably one of the hardest scenarios, not because of the acuity of the patient, but because of the patient to nurse ratio. And some places, I will agree, the ratio to nurses and patients aren't bad. You think 20 patients, but if sometimes they were hospice, sometimes they were just, palliative care. They didn't have a lot of things. It was totally doable.
Sometimes you didn't even see certain patients during your day. Like, you would just kind of like lay your eyes on them so you can chart that you laid your eyes on them. But you didn't, there were no procedures, like, especially if you had a med tech, you didn't even have to give them medication. They didn't have any wounds. They didn't have anything. They were just basically living there. You just like,
so it wasn't that bad. So don't let the word long-term care facility scare you if you want to work in that scenario. If you might have to, if your sponsor requires it. It's not all bad, but yes, there are bad moments and bad facilities, just like there are bad hospitals. So, just because it's a hospital doesn't mean it's going to be great, doesn't mean it's going to be, awesome. There are bad managers, bad businesses, bad, hospital managers that what patients think it's a hotel. So it's not just because it's a facility or a health or a, a nursing facility, it's going to be bad. But the time I was there, I feel like I have a bad experience. So it's not the experience that everybody had.
Yeah.
So I feel like my example was like a bad sample out of the whole batch. So, the management was very much like, time is money. The more you can do, the better. They didn't really consider your limits, your experience, So it was very hard because because I was an agency nurse, I would always get put on the worst place. So like the most patients, the most acute patients, the patients that were always in and out. They weren't the long-term care patients that were calm and easy. They were the hardcore post-surgery, trach, PICC lines, 100 CBGs a day patients. So I had a very bad example, but when I could step away from that, it was doable.
Side note here, somebody brought up a question this week, which was, I'm kind of afraid that by being foreign, by being international, I'm gonna get like the worst spots, that the best spots are gonna go to the natives, to American nurses. And I said that's not necessarily true in the sense because of nationality, because they're used to people from all over the world, so that's not it. The reason why she wasn't getting the best assignments was because she was an agency nurse. She wasn't a staff nurse. But again, that varies, and that there's seasons. I feel like I had seasons of that too, where I didn't get the best assignment. But then once you kind of become more frequent in that location, then you kind of become one of their own too, and you start to get little perks here and there too, right? So it's seasons.
The reason I was put in that worst place was because their own nurses didn't want to work there.
That's right.
So there you go. That place never could have a nurse that wanted to work that ward. So it was just 4 aisles. So it was like the clinic, the facility was separated into 4. And the number 1 place, it was the place that no one nurse wanted to work. So they always needed an agency nurse on that place.
Yeah.
And, learned a lot there, but a lot of the nurses I would work with were not even American. I think out of all the nurses that I worked, I think like 10% of the time, it was an American nurse. Most of the times, it was Filipino nurses, West Suisse nurses, so nurses from either an African or an Asian country. So that's not the same. No, it's not true.
Yeah.
But basically, it's the place that I worked was a lot of pressure, a lot of patients, a lot of procedures, and when I told the manager, the Saturday nurse manager that I was leaving, we weren't moving right away, but I was going to leave that place. And she said, I knew it. She goes, the good ones always leave here.
Yeah.
So that kind of stuck with me because she's like, I saw it coming. Meaning she knows that if you're a good nurse, you're not going to stay there because it's not a great place to work.
And again, that brings me back to the whole shortage thing, because if you think about it, why would sponsors go through all the trouble of sponsoring a nurse, all the money that goes into it, all the immigration steps and everything, to place them in outside bedside care, or, universities and teaching hospitals and the best of the best? You don't need to, because the American nurses want to work in these places, right? The American nurses want to be nurse practitioners, want to go into teaching, want to go into work from home. They want to, just get a different pace, right? Because bedside care here, we bring it up a lot nowadays. I feel like it's more common knowledge that it's a different work than in Brazil, because you're on your feet a lot. You're not at the table. You're not sitting down at the table. You're really, really bedside. So a lot of nurses want to step away from that after a few years. So we get this question so much. Can I start working in detox? Can I start working, in clinics, from home, whatever? You really can't, because no one is going to sponsor someone to come and fill the positions that American nurses want to fill themselves. We're coming here to fulfill a need, and that need is in bedside care. Like it is what it is.
Yeah, that need is in the places that a lot of nurses don't want to work because, and then that's where we want to get into. It's not because they're retiring. Yes, that's part of the reason, but that's not the entire reason. The main reason is a problem that existed pre-pandemic was only aggravated with the pandemic.
Yeah.
Pre-pandemic, nurses were already kind of tired of being treated, like they're just, robots that are there to bring in money. Because that's a lot that you hear from nurses that work in like big chain hospitals.
Yeah.
They need to cut patient care short. It's literally how much procedures and how much patient care you can squeeze into an hour. And it's like, we're not robots. Patients are not machines. You can't put a time on how long it's going to take for me to do certain thing. There is feelings involved, questions involved, emotions, fear, doubt, maybe an experience involved. So there's so much that goes into that. Nurses sometimes get treated like, they just have to bring in money to that facility. And if they can't, then, they're just discarded. And a lot of patients, I had this experience when working with a rehab hospital. You know which one because you also worked there.
Mm-hmm.
It wasn't a very acute hospital.
Yeah.
But I was always I had like 5 patients, but it was almost just as bad as a long-term care facility.
Yeah. I get what you're saying.
I was on my feet most of the time because I had more documentation. I had more procedures per patient to do. And the patients there were 9 out of 10 times
needy.
Very needy. They would treat it like it was a hospital.
Yeah.
Not a hospital, a hotel. See, we're confusing things.
Yeah.
They would treat it as if it was a hotel, and it's like, can I get my coffee warm? Can I get a burger? Can I get another pillow? And it was...
Oh, you, as a nurse, you bring patients ice chips. They bring some... The one facility that I worked in Albuquerque that I was there a lot, they were very entitled, and I heard that as soon as I got there, the nurse that trained me, she said, patients here, they come in with a mentality of being catered to. So kind of like that, like a hotel mentality. And they paid a lot of money, and like it was a high-end facility. Mm-hmm. So lots of patients there had a lot of money, so they're used to being catered to. So literally I get like a ring, like a call light, and I go there and they're like, oh, can I have some ice chips?
Not that we can't bring things, of course, we're going to be going to your room, of course, but sometimes we're in the middle of a procedure, drawing blood, or sometimes we're finally going to have lunch, and it's like, you barely have that time, maybe you're doing med pass, and somebody's ringing the call light non-stop, and you think it's an emergency, it's like, I just want another pillow. It's like, if the management would hire 3 more nurses, and I would have only you and 2 more, maybe that'd be possible.
Yeah.
But because management is just so like, the answer to everything is not to hire more nurses. It's not the problem with staffing. Like, you're the problem.
Yeah.
And then they just put all this load on top of you that it was never supposed to be yours. So that all brings into the problem of why nurses are leaving.
And I feel like most nurses, they like the patient care. They like being bedside, in the sense, like, they like to do the procedures. They like to do that. But all that other pressure, like the pressure to fill in whenever you're understaffed, like you have to go because, you have to go, like that pressure, just the bureaucracy and all of that. I feel like that in working, I think from all the places that I worked, one thing was in common throughout. People would start leaving when we were understaffed. Like, if we were too understaffed all the time. So the place that I worked here in Austin, that other rehab hospital, all the time we would get there, we're not fully staffed. So not just nurses missing, but techs missing. We worked with techs, and they did a lot of the ADLs and things like that. Oh, yeah. And we would be short on techs, so that means that that's more on you.
You have to do more per
patient.
Then
if you don't have a nurse and you don't have an agency nurse filling, you had to split that assignment with another nurse. So instead of having 6 patients, you all got 7 or 8 because you're splitting someone up. So every time that would happen, I would hear the nurses saying, that's it. Like, I'm done. I'm done with this place. I'm leaving. Because I felt like if nurses got to work and they were fully staffed, they would feel more equipped to keep going. Because most nurses like the patient care, but just that everything else on top makes it really hard and makes you want to leave because you're overworked.
Yeah. So I mean, this is not. I don't want, if you are not working here, we don't want you to think that this is a rule. Every place is like this. It's not. There are many places that staff appropriately, that have a safe nurse to a patient ratio. There's a lot of facilities that do care for the safety of the patients. For the nurses for them to have a satisfaction in what they do, because there is this measurement. They ask you, at the end of the year, like, how, if you're happy with what you're doing. So there are places. We just never had the chance to work in these types of places. That was, well, maybe you did once.
I did, yeah.
But like bedside, not detox, not alternative bedside, like for real bedside patient care, and a place where you didn't feel like it was unsafe. You felt like you liked it, and you felt like you had the support of management, because that's also something important. Having the support of management. When you go to your manager, or your, a nursing manager, a DON or somebody, and you go with them for help because you need it, and they dismiss you, they say, it's your problem, deal with it, I'm busy, don't you ever call me for help. That is absolutely the worst, because we'll literally be in the middle of a situation where it's unsafe, and we doubt, should I call for help? When in reality, of course you should, but you don't, because you're afraid to be fired, you're afraid to be called out, you're afraid to be made fun of. So I feel like that is like probably, one of the top three problems. And I had managers at that place that, someone was asking for something. I said, what, I'm not sure, I'll just forward you the call. And she came up to me and she said, don't you ever forward calls to me again? I said, well, I had no idea what this person was talking about. I'm new here. Or a manager would come and ask me if I could clip a patient's nails.
Good management is everything. And so when we're talking about facilities where you have a lot of patients and facilities where you don't have a lot of patients, so it has a lot to do with the acuity of care. So when these long-term care places, skilled nursing facilities, the acuity is very low. So you don't ever have anybody on, blood transfusions. You don't, it's not anything like that. We've talked about that here before. You basically do med pass. Sometimes you have a med tech. The most, invasive, thing you could have would be like a PICC line.
A G-tube.
Yeah, an NG tube.
But you don't do it. It already comes like that.
Oh, so you just don't insert it. And so the lower the acuity, the more patients you're going to have, because it's not, something that they need constant, vigilant care. And then when the higher acuity, the less patients you have. So ICU nurses, they'll stay with 1-2 patients, So just so you guys know, like if you don't like the acuity, you don't like the high complexity of care, then you can certainly go to facilities that have more patients and less acuity. If you like the acuity, you like the procedures and the complexity of it all, then you're more tend to go to a more acute setting.
Yeah.
So,
and there's all kinds of places. There are places that are more private insurance. There are places that are more public insurance. So it's like Medicare, Medicaid, for those who don't know. There are government-based insurance assistance. So, the more government-based, the less quality is going to be, unfortunately. So there's all kinds of places, and these places are always needing nurses. Yeah. So, you really do have a power of choice in these situations. Yeah. They actually don't have a power of choice. They'll just hire, if you want to work there, they'll probably, interview you, but you having the minimum qualifications. You don't have to be specialized in anything, just a med surge. Basic universities is enough. Yeah.
And definitely a takeaway for you guys is if this is something you aspire to, and I feel like a lot of nurses do, in the sense that, and we talked about this on the stories, you guys voted. That is a tendency in Brazil and here as well. So even if the place is not toxic or anything, most nurses eventually want to keep moving up the ladder, right? Yeah. Most nurses don't want to stay in med surg forever or want to stay in bedside care forever. They want to move up to management. They want to move up, not just for the salary, but just, for pace of work or, whatever the case may be. And that's perfectly fine if that's your case too. Like your dream is to come here and you want to be, a nurse practitioner and you want to teach. Like I fully believe that anybody can do these things. We're our education as Brazilian nurses, like we have a good education. We have good things going for us. We're resilient, we're resourceful. So I think we can definitely stand out. But it's not going to happen like overnight. It's not going to happen right away. Like she can talk more about that. She is in one of like her top dream jobs to have, but she didn't get here and got that spot right away. She wouldn't even have qualified because she didn't have experience. So it doesn't matter that like she has English or whatever. She might have had something in Brazil. Like even if she had experience in Brazil, she wouldn't be qualified for certain positions here. So you guys, if you have that dream of leaving bedside care eventually for whatever path you want to take, you can do it, just not right away. You guys got to come and you got to do what you got to do. You got to work where you got to work, where there's opportunity. You got to take in that experience, take in those hours so you can finish your contracts. And then you can move up the ladder and go wherever you want to go, as a nurse.
Yeah. I definitely, when we were getting hired by Westways, when our sponsorship was underway, and they didn't really tell us where we would work. Just like if you are in your sponsorship process, you only find out like closer whenever you start working, or even like when. And we didn't have the option of choosing which state. It was New Mexico, that was it. Okay. So we already knew the city, but we just didn't know the place. So when we got to training, they just told us long-term care, and I didn't know what that meant. Like, I had no idea, but I was like, I'm pretty sure it's going to be bedside care. I'm 100% sure it's going to be bedside care.
Yeah.
And obviously, I was very afraid because I had never worked.
New grad. Yeah, she was a new grad.
Never worked as a nurse. My first kind of like real jobs I had in Brazil weren't like, career jobs. They were just like side jobs. My first real job, first shift ever, when I went to train, I was like, yep, I knew it was going to be bedside care. So obviously that fear was there. I was a little bit afraid.
Insecurities.
I was insecure. I was, very like nervous of how it was going to be like. Yeah. And I'm not gonna lie, the first few shifts were difficult. They were, high alert, high stress, high anxiety moments,
as they are for everybody.
Even
the people who come with a lot of experience, they get here, they're like, because it's different.
It's a completely different world. Even though I had the English, I didn't have the experience.
Yeah.
But a lot of people who don't have the English but have the experience might face very similar issues. But, all of that experience kind of, made me into the nurse I am today. And obviously in the time, it was not my favorite option. If you remember, if you were to have studied with me in university, I never said I wanted to work bedside. I always said,
she was always the one to...
The furthest, I used to joke, like, the furthest place away from the hospital, that's where I want to be. That's where I want to work. Yeah.
And if you're, side note, if you're asking, then why did you do nursing? Like, if you didn't want to do bedside. If you don't know this about us, like, we literally did nursing to come to the U.S. Like, I've seen some people do that now that they know about this opportunity. But we basically chose nursing in order, because we knew that there was this pathway to come to the U.S. So that's why.
Yeah. So I knew I was going to have to work in bedside, but I wasn't sure if that was going to happen. But
I remember Brazil used to ask me, do you think that I'm going to have to work bedside?
You think
so? In my mind, I used to be like, no, I'm sure they're going to have lots of options. But like deep in my mind, I'd be like, no, honey, you're going to
have to work it. So, I mean, I'm glad you lied to me. That made me a little bit more calm. But, there are certain things that you just have to go through it if you want to come out the other side, right? If you want to pass the NCLEX, you have to study. Yeah. There's no way around it. You need to study. You need to learn the content. You need to pass the test. There is no way around it. Just like
the only way to it is through it, right?
It's just like, graduating nursing school, right? To obtain your diploma, you have to go through everything. You have to go through all those classes, all those clinicals, this is it, all of that. You can't just buy your way. There are people who do it, I'm sure, but you to do the right way, you got to go through the process. And certain things, so if you have a sponsor that requires you to work at bedside care, it might suck a little. It might not be the fun, but it's gonna be so quick.
It goes by.
It's gonna go fast. It's gonna be part of your experience. Think of it as this is just an experience moment. You don't have to stay in it. You don't have to continue working. You get to play the I'm a new nurse here card for a few months. Try to learn from those experiences. Try just say, no, I'm not going to make a career out of this. If you just want to come, get your sponsorship, complete your contract, and say, I'm leaving nursing, I'm never going to work as a nurse, that's up to you. If you complete your contract, you fulfilled your duties, you don't want to work as a nurse anymore, you can leave the field if you want to. But, fulfill your contract while, you're still with your sponsor. If you have to work in a bedside job, a lot of jobs that are not bedside require bedside experience.
Yeah.
Out of all the interviews I had the last 2 years, all of them asked for bedside care experience. And they would always ask, how many years did you have? What kind of settings did you work? And every time I would say long-term care, acute, rehab facility, they would all be like, oh, okay. So meaning they know, you saw some stuff.
Yeah.
I actually interviewed for a specific place that was, it wasn't to be in a long-term care facility, but it was to work with the management team.
Mm-hmm.
And it was remote. And nursing home facility, so nursing care, long-term care facility experience was required. And I said, no, I've worked in those places. I know how they work. And I chose not to go with that one. But, they asked for that kind of experience. I thought, I would never have thought that my experience with a long-term care facility would come into maybe benefit me even. Yeah. Not just from the things I saw, but my experience there on my, on paper, on my resume. Yeah. So it's really about you not thinking it as a long-term goal, I'm going to stay in this forever. It's going to be quick, try to get the most experience from that time and try to learn from that time. Yeah. But if you don't want to stay in it, you don't have to.
Yeah.
And it's, in other words,
you just got to finish your contract first.
You gotta finish your contract.
Finish your sponsor contract first, y'all. Don't don't do that.
Yeah, don't leave your contract. It's not good for you. It's not good for your future jobs. Here they are a lot about recommendations, and whenever you leave a job, you always want to leave it well. And I'm so glad my contract finished. I left it with the place I was at. I left it so well. My previous supervisor, she called me the other day. Yeah. Asking about, how we help international nurses. So it's really a balance. The first few months you're going to live here are remember when you were in college, if you already graduated, and you remember from your first year, primero periodo. Do you remember that?
Yeah.
Barely. You barely remember. You don't even know what happened. It's such a small time on your 5 years of school. That's how your first months are going to be in the U.S. Whenever you look back, you're like, wow, those months were intense, but they were just such a learning moment, such a learning period. And if you want to get to teaching at a university, good for you. More to it, yes, absolutely. You will get there. You just have to go through some steps before. You can't just get here. No one goes into a company. No one starts at a company and expects to be the VP. Of the company day one. You gotta work your way up, and nursing is not that much different. You might have to work a long-term care facility, you might have to work rehab hospitals, maybe detox, maybe climb up, maybe switch areas. But if you want to get to that place, that's totally possible.
Yeah.
And just be realistic.
That's true. And before, we always get the question, oh, does Westways place us in non-bedside care spots? And the answer to that question is yes. I think they're one of the only sponsors that I know, that I've seen, that have opportunities outside hospitals, outside bedside care. However, there are not a lot of those, and it's not right away. You can't expect to just come and get those. But the ones that are most common are correctional facilities. We have had, and we have currently a couple of nurses working in correctional facilities in Indiana, and we've had in California, and also detox facilities over here in Texas. So yes, there is a possibility. We've only now recently almost had one of our nurses come to Texas for one of these spots. But she already has experience. But yeah, like I said, it's not something you can get to right away. You got to get some experience under your belt first, and then you can switch. So if that's like your goal is to eventually transition out of hospital, Westways is a good option because they do at least have these options within your sponsor contract still, which is not something common with other sponsors at all.
Yeah.
You would have to finish your contract and then transition afterwards. So
yeah.
Anyway, y'all, that just about sums it up for our third episode of Nursing Conversations. Hope you guys enjoyed it. We're gonna save it so you guys, if you didn't get to catch all of it, you can definitely watch it later. And please leave in the comments topics that you want us to go over next time. And thanks again for sticking around with us.
Thanks, everybody. If you want to know a little bit more about us, check our page. We have our story there. If you're interested, if you are an international nurse, Brazilian or not, and you want to know more about our services and how we can help you, we can help you in your validation process. We went through all of that as nurses ourselves. We can help you get your RN license, and we can connect you with Westways. They sponsor nurses. But if you don't want Westways, you have your own sponsor. We can also help you. We'd love to help you in your process. Or if you just want to talk and want to be friends, we can also do that. We will see you guys next time, and happy weekend.